So, without further ado, I would like to invite our distinguished speaker, Dr. Hajah Salina Abdul Aziz, to deliver her keynote address. Dr. Hajah Salina, the screen is yours.
Okay, Bismillahirrahmanirrahim. Thank you very much. Dapat dengar tak?
Boleh, Doktor.
Boleh ya? Okay. Let me get the slide on before we start. Okay, can you all see the slide now?
Yes.
Thank you. Thank you. Susah ni tak nampak audience tau, tak tahu apa yang berlaku. Sama ada tidur ke tidak? Okay. Jangan ketawa. Okay. Bismillahirrahmanirrahim. Assalamualaikum, salam sejahtera. Yang berusaha Dr. Ramli, Ketua Jabatan Psychiatry Hospital Tunku, Azizah, all the young specialists, all the MOs, and everyone who is on the platform today for this launching of World Mental Health Day. Thank you very much for the invitation and the opportunity to speak a little bit about this on this platform. So we know each year on the 10th of October is our World Mental Health Day. Why we have our World Mental Health Day? Actually, it is to raise awareness about mental health issues. Maksudnya sini kita nak buat-buat bising sikit lah pada World Mental Health Day ni. Kalau tidak senyap je kan. So during the World Mental Health Day ni, everyone will get excited, do a lot of promotion, okay, with regards to mental health and bring out issues with regards to mental health. This year, the World Federation of Mental Health, I think, dia punya theme is mental health in an unequal world. Okay, this theme actually emphasize equality in mental health services regardless of boundaries, and where every individual has a right to good mental health service with regards to accessibility anywhere and anyone. Okay. Tapi ada sedikit kekeliruan, a bit confusion because there is another team. Okay, that this team is by WHO, World Health Organization. Mental health care for all. Let's make it a reality. Okay, if you look at this team, actually, it's almost the same. Talking about the same thing. It's talking about opportunities to people of mental health to get care. Okay, so one team saying it negatively, the other team is positive. I guess, you know, you can see that the first team tadi tu, unequal world, it is more of a negative connotation, whereas this one, you are speaking more on a positive connotation, mental health care for all. Okay, so generally, both team actually tells us to promote and to ensure that all our mental health patients gets opportunity and gets treatment. So every level or every opportunity to everyone who have mental health issues to get treatment. This year, I think during this year, WHO punya assembly in 2021, government around the world actually recognize the need to scale up quality of mental health service because of the COVID pandemic. They think that they need to scale up the pandemic, and a lot of countries was very good in scaling up their mental health service. Okay, but I will talk about Malaysia a little bit later. Okay, let's go to the next slide. Yeah. So when we talk about unequal world ni, apa maksud unequal? Unequal ni adalah situation or situasi where you find it is unfair because it gives more power or privilege to one person or a group of people as compared to another. Yes, we are living in a world that is an unequal place, which means most of the things are not equally distributed, whether it's health, whether it's wealth, okay, whether it's financial, whether it's work, whether it's resources. It is not equally distributed. Okay, So each of us experience different with regards to human rights, opportunities, and quality of life. So we have different experiences. Even if we are in the same country, we have different experiences and opportunities and quality of life. So inequalities, why it happens, it can be linked to many causes. Why you have inequalities? Be it this political, be it disaster, be it geographical, ada banyak, a lot of causes why this inequality occurs. Okay. So when we talk about inequalities, unequal world, there are some people in this world, philosophical people lah, yang rasa, no, there are certain things that we need to give, how to say, equal opportunity. Okay, equal opportunity in the sense that we need things like food. People think everyone must have food. Okay, must have food to survive. Everyone must have shelter. Okay, everyone must have the opportunity and the right for good education. Okay, and everyone must have good medical services. At least a standard, okay, standard level of medical care. So WHO is more motive on this. In this, you cannot run away from unequal world, but we try to ensure that certain things, certain opportunities is given to others who are in this unequal world to achieve actually food, shelter, education, and healthcare. Okay, so what about health? Tadi kita cakap pasal health kan, one of the thing that in the world is healthcare. Okay, health inequalities are the unjust and avoidable differences in people health across the population and between specific population. Okay, across the population and specific population. Maksudnya sini dalam populasi dan juga certain specific population yang mungkin ada sedikit injustice or unjust. Okay, health inequalities are systemic differences in health status of different population group. It means different population group, you find that they have different sort of health status or inequality. And this inequality have a significant social and economic cost, both to the individuals and the society. Okay, if you look at it, ini lebih cakap kepada NCD lah. Kalau NCD, you look across the individuals and society. That's why I think the government came up with B40, T20 and whatnot. Okay, so health inequality therefore involve around differences in 4 areas sebenarnya. Okay, bila cakap health inequality ini belum cakap pasal mental health ya, kita baru cakap pasal health. Health inequality involve around 4 areas. Health status, maksudnya life expectancy. Okay, life expectancy in the sense that people life expectancy between countries are different. Sometimes between the social status is different, the life expectancy. Why? A lot of social variables that ensure that your life expectancy is different. Okay, access to care. The second one in health inequality is access to care. Okay, the availability, accessibility of care that will somehow increase your health status. That means you have access to care, you have care that you can afford, because we are very lucky. We are in a country where healthcare is given free, actually almost free, although you have to pay $1 to $5, almost free. So our access to care is, the affordability is there. Accessibility with the health center, with the many major and minor hospitals, we are quite accessible to our health. But if we were to compare from to other countries, I think we are one of the best countries with accessibility to health and affordability. Okay, quality and experience of care. Quality experience of care ni, it means that that's why you see a lot of patient wants to go to certain hospital. Okay, a certain hospital they find that the quality and care is better in certain hospital. Okay, and not everybody get the opportunity to go to this certain hospital that they find that it's good. Okay, or some hospital that you have to pay to go there. How many people wants to go to IGN but they can't? Okay, because not everybody has access to it. Accessibility tak ada. Behavioral risk to health. Okay, for example, smoking. Smoking is more rampant in which sort of countries? Okay, which area? Who smokes? Okay. Other determinant of health like housing. Okay, this one we will go a bit more. Okay, into this. So, health inequalities can therefore evolve differently in health status, saya cakap, access to care, quality and experience of care, and behavioral risk to health. So next, so what about inequality in mental health services? Mental health inequality refers to the differences in quality, access, and healthcare in different communities or population receiving for mental health services. Maksudnya sini, the care for mental health, okay, the care for mental health is different from each area, okay, and it is the social determinants of mental health. Okay? So the health inequality can have there are a lot of factors that can lead to this risk to mental health with regards to social determinant of mental health. Example, employment, food, access to care, education, poverty, poor neighborhood, social exclusion, housing. I will talk a little bit more on this. So now we understand that in this unequal world, okay, there are factors that is in the society or community that can lead to inequality of mental health services. Okay. So, this picture sort of sums it all to what we are going to talk a little bit more later. So, how mental health system and policies, okay, must be in place to ensure that this inequality, okay, of service, mental health service, is balanced. Okay, it's balanced. The thing is, you cannot sort of give the best service all the time, but it's balanced. That means you have to give a standard, a standard sort of service where everyone can get. Okay, so if you have mental health system and policy in place that is good, you will then get people or the population who are mentally well. Okay, so let's look at some of the issues when you want to plan policies or system in the health. Okay, one of the things that people talk about is the social gradient in mental health. Kalau you buat master ni, banyaklah cerita pasal social drift, down drift theory kan. Social gradient means that mental health problems are more common further down the social ladder. Ini yang kita buat our ministry did. We did our PERKA B40. Okay. One of the assessment tool in PERKA B40 is mental health. Okay. I just spoke to the designer of the PERKA B40. Not many people are doing the mental health punya module. Okay. And actually not I think they have lots of data there if anyone interested to look at the assessment they did in PERKA B40 with regards to mental health. Can you have PERKA B40 where people come and do assessment? It includes physical assessment, but there's also a module for psychological assessment, also mental health assessment. So we know from a lot of studies there is an increased risk of mental health problem with lower mental health being. That means the lower you are in the social rank ladder, the likelihood for you to have a mental problem is higher. So being poor can bring about mental health problem. Most commonly, anxiety and depression. But mental health problem can also lead people to poverty. Dia terbalik lah, macam saya kata tadi. This is a short note selalu dalam master student lah. Is it poverty causing mental health or mental health causing poverty? Which means mental health problem can also lead people to poverty, because once you have mental health, you are discriminated in employment and you have capacity for you to get work is less. Okay. So sometimes it is also related to being a part of a disadvantaged group. Disadvantaged tu sebab you are mentally ill lah. Okay. Most of our working punya question ada, have you ever been treated mentally? So that one will put you in a disadvantaged punya group lah. Okay. Social economic inequalities, that means poverty, okay, lead to mental health problem. So why does it lead to mental health problem? Because when you live in poverty, it is a condition where people are born, where you grow, where you live, and where you work, and where you age. Maksudnya Siti, if you do not change that socio-economic environment, you will grow, live, and work in that socio-economic, you will not come out of it. When you are in that in that environment, the chances, the risk of you getting a mental health problem is higher. Tadi kita cakap kan. So if you are in the lower you are in the social ladder, the more likelihood you get a mental health problem. Okay. Social inequalities and mental health, okay, they have divided into a few areas lah. One is economy, dari saya cakap tadi kan. Other relational influences, okay, health, disability and aging, environment influences. I'll go slowly into each one of these. Okay, economy influences. Kita cakap tadi kan, economy is makes a lot of impact lah on inequality in health and mental health punya services. So living in poverty, debt, income inequality. People in the lowest socio-economic class have the highest risk of mental health problem. This has been found in many studies. Okay, and socially disadvantaged children and adolescents are 2 to 3 times more likely to develop mental health problem. Okay, 2 to 3 times. That means there is an increased risk. That means there is an increased likelihood for them to develop mental health problem. Let me remind you, sometimes it is not just the poverty. It's a few factors with the poverty that can lead to this. I think we will go into this later. Employment and unemployment. Okay. Important factor in individual fulfillment, bringing autonomy, pride, and confidence. So when you are unemployed, okay, you can become mentally, it can disturb your mental health, especially because actually working, when you work, you have this sense of achievement, you have this sense of, you have confidence. I have seen a few people during this pandemic, they have lost their job and unable to get job, and this sense of failure, this sense of you cannot control anything, and then the confidence in yourself, like it just gone. Okay, so employment and being unemployed is very important factor actually in the society that can affect you punya mental health. Education level, what they find is dropping out of education has been associated with substance misuse, mood disorder, and suicidal ideation. Especially those who can't afford to continue work. When you have a good student, good people who come and becoming frustrated So they get associated with become depressed, become suicidal, or they can misuse drugs. Okay, the second one is other relational influences. Okay, this one cultural or social group status, macam migrant, refugee, asylum seeker. I've seen a few people who have done studies on immigrant and refugees lah, with regards to mental health. Hello. Siapa cerita Filmora tu? Okay. And then with regards to stigma and mental health, with regards to stigma ni macam mana stigma? Stigma is a sense that when you talk about stigma ni, people who are who are being excluded, you know, bila you nak you want to do something, it is because you have this mental illness, you are being stigmatized or excluded. Okay, macam nak kerja, nak belajar, you want to go to university, okay, because you had some symptom of mental illness, you're being excluded. Okay, so adverse childhood experiences, ni very important. Adverse childhood experiences ni, for example apa? Physical abuse, sexual abuse, emotional abuse. Okay, they find that those children who has adverse childhood experiences, okay, these were indirectly responsible for at least 30% of the mental health problems. Okay, maksudnya children who has experienced adverse childhood experiences, 30% of them were found in the adult punya mental health problems. Okay, adverse experiences in adulthood. Okay, even adult can have adverse experiences. Okay, maksudnya sini things like rape, loss of jobs, serious illness. Serious illness ni sekarang kita tengok banyak yang COVID lah, who had gone through, you know, ventilated, who have, you know, been put on ventilator and survive, you know, that a lot of this has adverse experience in adulthood lah yang kita nampak sekarang. Or those who have a loss during this COVID period and you had no chance of saying goodbye. Okay, so all these experiences can lead to mental health issues. Loneliness, ini our society now, social isolation is an important risk factor for both deteriorating mental health and suicide. Actually, in suicide, this is a big factor, loneliness. Okay, people, we are living in a world where we are connected. Okay, connected, interesting. Like today lah, connected. I'm talking here, but I'm feeling very lonely because I cannot see all of you. I don't know what's your expression. I don't know whether you are sleeping or you are, you know, it's very lonely giving lecture like this. You are very lonely. So actually, although we have social connectiveness, okay, connectiveness sekarang ni, tapi the isolation, the loneliness is there. Okay, so this actually not very good in the sense that for our mental health lah. Somebody asked me whether the cognitive the connection that we get through social media, through the social media is good. Actually, it's not good. Sometimes it can be disadvantage also. Okay, let me just check the time. Okay, I'm on time. Connection between physical and the third one is health, disability, and aging influences. Okay, kita tahu kan, most of us know about consultation liaison. How we know that our physical health has a lot of impact on our mental health. Sebab itulah ada special subspecialty panggil consultation liaison. So here we know that the connection between physical and mental health is reciprocal. Okay, those who have physical health problem are at increased risk of developing mental health problem, while mental health problem increase the risk of physical health problem. That is a reciprocate both ways. Okay, so the more people are disabled or having health issues, it can affect their mental health. Okay, so especially those who have long-term health conditions. Okay, they are 2 or 3 times more likely to experience mental problems, especially things like anxiety, mood disorder. Okay. Ini kita lihat ya, especially those with problem with oncology, renal, problem with respiratory. So this long-term condition can somehow lead to these people to experience mental health problems later. Okay. Okay, the final one, environmental influences. Okay, environmental influences also have effect on how your mental health. Okay, strong evidence shows that environment in which people live, grow and work can affect their mental health. Okay, tengok grow and work. Work ni pun, that's why you have OSHA, but to ensure that your mental health is well. Okay, live and grow. Ini yang kita tak out of our control. Live and grow ni, things like your housing. Okay, lack of adequate housing. At one time, you have a flat with 1 room or 2 room for a whole family of 7 or 8. Okay, which is I think not a very suitable environment for you to live, especially young children. Okay? It can lead to a lot of things, including the adverse childhood experiences. Okay, or where there is transport option. Okay, transport option. How many of my young psychiatrists who travel to KL every day, 2-3 hours from Bangi or from Kajang, or far away of Seremban, and yet actually the transport or how they come to work, they communicate to work, some of them has been very stressful. It's been very stressful. Has affected their mental health. I've seen quite a few actually. Okay, neighborhood deprivation. Okay. Neighborhood deprivation macam apa? Macam you live in a neighborhood where there's no space for exercise, there's no space for recreation, you're just stuck in this small cubicle, okay, and go to work, okay. So an adversely built environment, okay, environment where you stay, it builds with housing with no flat, staying dekat basement. You see this a lot actually in Mak Saleh punya ni lah. But now kita punya planning a bit better, but the houses are not very cheap. Living in urban environment, okay, sometimes living in urban environment is very, very stressful, or in adverse natural environment. Okay, that's why now we have a lot of advertisement. Kalau tengok sekarang, advertisement on newspaper on good environment and positive environment for your living, kan? Ada lakeside lakeside house lah, natural environment lah, near forest reserve lah, where but the cost is sky high. Most of us cannot even afford. Okay, or you can even live in a dusun. It is you can get this good environment, but it's not for everyone. So itu yang dikata inequality tu. You have to have this sort of good environment for everyone, so that you ensure that everyone have good mental health. But this good environment is not happening for everyone. Itu yang now they say that although it should be made available to everyone, this good environment. It doesn't have to be lakeside lakeside punya semi-D or bungalow, but at least some thought has been put to have a good environment for the population. Okay, to recap, if we want to do this, economic influences, other rational influences tadi saya cakap, health and disability, environment influences, we cannot do it alone. The psychiatrists, the clinical psychologists cannot do it alone. This is a whole health system punya system. Okay, so if you want to prevent mental health issues or mental health problems, it is not just us. It is not just us. It involves a lot of sectors. Okay, it involves a lot of sectors where everyone have to play their role. If you were to look here, it involves Kementerian Pembangunan, housing. It involves how you town planning, it involve NCD, okay? It involve the police, it involve the lawyers, okay? It involve the financial people, how to plan to ensure people get jobs, how to ensure that, you know, give a good education so that people don't get stuck in this economic punya apa, right? So that means when you want to do mental health, when you want to do mental health prevention, it is not just you, okay? It is not just you. You need to go out and talk to all these people and convince them. You need to go out and talk to people in the housing, with the police, with the NCD to ensure that this can be solved. Okay, kita cerita sikit a bit more about this. Is my time still there? Okay. So, bila you cakap pasal you nak improve, this is an example I got from ni. When you want to improve the ni kan, the promotion or prevention of mental health ni. So, bila you cakap pasal reduce economy inequalities, okay? Ini yang you cakap reducing class size, you know, yang cakap T40 sikit and whatnot, you have to reduce. There's a lot of things that you can do, okay? You prevent domestic violence, sexual violence, okay? What you can do, this is where you come in for the lawyers, for the AG chambers to come up with laws regarding this policy, okay? You want to stop substance abuse, kurangkan. You know, you have alcohol minimum age, cannot drive when you're drinking, okay? So these are things that you do, but it's not you as a psychiatrist, but you as a part of the community, you should speak for this. Why is this important? Okay. See, if you look at this, yang we clinical specialist care ni kat sini saja, sikit saja actually, right down here. Okay. Okay, affordable housing, public space, community participation, okay, improve school engagement and emotional. You need Kementerian Pendidikan here, okay, trauma informed public services, okay, psychological therapies for children. So it is a huge thing. Okay, I cannot teach you, or I cannot be talking about too much on this, but you must remember that in doing prevention and promotion of mental health, you cannot do it alone. You need a lot of partners from all ministry. There is a lot of things that you can do to reduce the mental health punya problems. Okay, some of these what you do are indirect effect to your mental health. Okay. As we mentioned just now, dari awal-awal tadi kita cakap pasal inequalities are all around us. Okay. We must have a wide coverage of mental health promotion to reach all levels of society. I think, insyaAllah, alhamdulillah, for Malaysia, we have a very wide coverage of mental health services. But with regards to promotion, I'm not too sure because not many are coming to us, okay? Adequate screening to identify people at risk. This one, you need to work with the public health people. You need to work with the KK people on doing screening, when to refer and when not to refer. Okay. Good support for treatment. Good support for treatment ni mesti ada a way of, there are some patient who goes to health or KK, they don't want medication, but the doctors there only know how to give medication. They don't know how to do therapy. They don't know how to talk to patients. So you must, centrally you must support them. How to give good support for treatment, how to help them, okay? Comprehensive aftercare for people who living with mental health. This is not with us, it is with Ministry of Kementerian Wanita dan Penduduk and also Kementerian Kebajikan, where where you give supported living for those who are having mental health, chronic mental health problem. Not all sort of mental health, but people like schizophrenia, bipolar, you want to give them supported sort of living condition. Okay, so we want all this, okay, but we have to think of how you want to put this in the society. Okay. So when we think of mental health, we must think of apa? Again, that it is not our job, it is everyone's job. Okay, there are 4 ways you can do this so that a whole community approach is taken. One is task relocation. Okay, that means mental health ni bukan hanya pada all the psychiatrists, all the counselor, all the clinical psychologists. It's everyone's job. Everyone need to be involved. Okay, make every contact count. Ni interesting. Make every contact count. You see, especially those of you who are not lah kata in power, who have meetings with police, with other people in other ministry, make that contact, make that connection, make that networking, talk about mental health. Okay, ini selalu Dr. Ann buat. Whenever she talks on TV, whenever she talks on radio, you talk about mental health a little bit. Okay, have mental health in all policy. Maksudnya, if you look tadi kan, when you talk about housing, when you talk about school, when you talk about work, you tengok, mental health should be in all policies that you make. Okay, whether you talk about housing, rumah macam mana. When you talk about apa ni, you want to make apa ni, public space, all that include, you must have a mental health policy. Okay. And very importantly, lastly, is an understanding data. You must collect data. Ini kita tak ada with regards to mental health. Okay, especially crime level, domestic violence, bullying, absenteeism. Okay, so you have to produce data. You have to collect this data. Okay, I don't know who's collecting this data. Actually, public health should do this, and we must sort of correlate this with what's happening in the in the community. Sorry berhenti sekejap minum air. Okay. So, if we are able to do all this, okay, we improve the physical health, we improve the apa ni, reduction in health damaging behavior lah, macam apa ni, violence, apa ni, physical abuse, child abuse and whatnot. Okay, you have greater educational achievement, higher income. Okay, so it will lead to less absenteeism, less crime, improve overall, reduce mortality. In actually, when you do this sort of thing, you will not only affect the mental health, but you affect the whole society. A lot of things happening. Okay, the society become better, not just the mental health. Okay, this is a WHO study yang dia buat about risk of mental health problem lah, exacerbated of mental health inequality during the pandemic actually. I think I will skip this. Okay, so now I'm going to talk a little bit because I have a bit of time. Implication of COVID-19 on mental health services, our services. Okay, how did it affect our services? So when COVID-19 came, I think most of us were unprepared. Okay, it poses a lot of risk lah, beyond just the physical health. But the most at that time when it first came, everybody was worried about if they are going to get it. If they get it, are they going to die? So it put a huge strain actually on the people's mental health well-being. Okay, and the mental health stress ni, for those who are in the lower socioeconomic group, it is more. They find that it is more. And also people with existing mental health problem. Okay, you already having existing mental health problem in poverty, and now you have this COVID pandemic coming in. Okay, yang tadi tu. Okay, so this is something from WHO. They find that there is a disruption in the critical mental health service. Okay, 60% reported disruption in mental service for vulnerable people, including children, adolescents, older adults, and women requiring antenatal and postnatal services. disruption in counseling, psychotherapy. Okay, I'm not going to read all that, but this question came up in Parliament actually. Was mental health services how badly affected during our pandemic? You know, how many clinics were closed? Okay, there were a lot of us who had to close our ward. There were a lot of us had to deploy our staff and reduce our services. Okay, some hospital completely stopped their mental health services, which I find it is very, very unacceptable. How can you stop mental health services when the country is in a pandemic and the mental health services, the admission is not available in the private sector? So I think that is not right at all. Because when we talk about inequality tadi, okay, so actually when the COVID pandemic came, we had a lot of major effect on our inequality tu lah. Tadi economic downturn, job loss, loss of income, isolation, closure of university, closure of school, lack of childcare, you know, and essential worker had to, you know, face a lot of challenges, okay, at that time. So one of the impact yang interestingly yang it came out to me, it came out very worrying was the isolation. Okay, the isolation. People were living in isolation for nearly a year plus. Isolation. You cannot socialize your friend, your family. You cannot go to your father's house. You cannot move. If you can go, you cannot simply hug. You know, you cannot salam. Some of the things that you do can even be punishable through because of because of that pandemic. So the feeling of isolation is actually very, very, very high actually, isolation. And this isolation, let's say for even healthcare worker, you come to work, but you are isolated because you cannot socialize as before. Makan pun tak boleh makan sama dengan geng. You know, you cannot eat together. You have to eat alone. You cannot sit down and chit chat. If you have meeting, it's online like this. I cannot even see your face. I don't know your expression. There's no connection at all. Okay, so the isolation is very, very, very bad actually during this time. Okay, but we had the social media. Unfortunately, social media might be good, might not be good. Okay, and then adapting to workplace policy lah. Sorry, ini dah ni. So like working from home. Okay. Working from home does not sound as good as it is unless you're not really working from home lah. Okay. Okay. So it's not easy when you have to manage your own schedule and time, and then there's the blurring of personal and professional time. Maksudnya you are at home trying to work, but your children don't understand that you are working. You know, your children don't understand. They start screaming. They want this and want that, and they want you to be, you know, so that blurring of life makes it very difficult to do work from home, and a lot of distraction. Okay, there's no reduced supervision and direction, communication and coordination challenges. I mean, you not coordinate your discussion and your communication. Like today, you want to do the workshop, you must make sure that it's done well. You coordinate well. It's a lot of challenge actually. Okay. Unclear performance metric, you stay home, you don't know what you must do, how much you must do. Okay, and again it comes the social isolation, and this one is the worst of all, I think, especially mother with children. Online classes, is a lot of stress. Okay, causes a lot of stress. Gadget shortage, crashing system, and then distraction everywhere. Okay, distraction. Okay, staying motivated online. Yes, staying motivated online. Technical issues, connectivity, always lying down. Okay, diminished social aspect. Okay, and some students being left behind because they don't have this. And on top of this, I think I should add there WhatsApp to mothers. You know, if you have 4 children, you have 4 WhatsApp from teachers to you regarding your PDPR, and it is a havoc and a very stressful time. Actually, some mothers will celebrate the opening of school. Okay. And then we find that the population mental health during this time, because all the issue, ada banyak lagi issue, but I'm not going to talk too much. The population mental health, the mental health of the general population become worse. Okay, why? We see a lot more child abuse. Okay, ini tadi Timbalan Pengarah mentioned to you, child abuse, domestic violence, suicide, all has increased during this pandemic. So that is a reflection that our mental health has, the population mental health has somehow become worse, okay, during this pandemic. And on top of that, our essential workers, okay, who are being asked to work, okay, being asked to work but isolated, okay, they have also and also they are at initially they are at the increased risk of contracting the coronavirus. Okay, you have at the increased risk of contracting coronavirus, you are also at risk of bringing it to other people that you love at home. So this sort of scenario has been very stressful to our essential workers. Okay, how did we adapt to these new norms? How did our mental health adapt to this? Okay. So one of the things that this is a slide from actually WHO lah, safeguarding the mental health service. You must safeguard the mental health service, okay, to ensure that the population punya mental health ni tadi kan saya sebut population mental health ni reflection of your access to service ni. Kalau access to service is not there, itu yang dekat parlimen ditanya baru ni, anybody close and what not. Why? Because once you have people with anxiety, depression, people start, you know, domestic violence, start being angry with each other, they find that these people are not being served because you all have closed your hospital. Itu yang a lot to answer to. So WHO suggested that you must safeguard your access to mental health services. Okay, access to existing mental health services should be assured. This one, a lot of you close your services, so that's why there was a bit worrying. Access to existing mental services should be assured. That's the first thing WHO cakap. You must ensure that access to mental services is there. You cannot close it, okay? Mental health services quickly shift to a new mode of delivery. We now, okay, kalau you want to ensure that access is there, you now have to shift to a new mode. Mungkin tak, because now people cannot move. People cannot move from their house. But how can you do it to ensure that there is existing mental health service? I will talk a bit more about that. Mental health services should move significantly to non-face-to-face format. Okay, a new form of mental health support. Mental health support. Maksudnya sini, dulu you have counselling and whatnot. How do you do it now? You have the mental support should now be information material should be mostly online. Okay, adalah pamphlet yang you bagi sana sini. People actually what we suggested is kalau you buka Mas Jastra, are you stressed? You can always, you know, it should be linked to that. Okay, with information materials. Okay, mostly online. New mental health support phone line. Some of you did great in this. You had lots of phone line that you had where people can call up. Okay, shift mental health services to telemedicine format. In some cases, increase service capacity and entitlement. And in some countries, increase investment in mental health. So we did. We had quite some of money from ministry for this investment. We had computers. We had apa ni? Some of you had computers. Some of you had telephone line, I think. Okay. So how do we shift to a new mode of delivery from face-to-face to phone consultation and also to telemedicine? Okay, this is done with a lot of places, but unfortunately Malaysia ni, kita punya a lot of our device, a lot of our things that we use are so outdated. When we had this pandemic, komputer kita pun dah lama, ada yang dah orang kata apa dah tak sesuai untuk this. So we were caught lah in this, you know, for new computers which can go, which have, you know, video conferencing technology and whatnot. Okay, so we can shift, but at that time there was a lot of logistic issue. Okay, so this one you must think about it. Okay, oh tak ada, hilang dia punya tu. Okay, ini is we also change to our new mode where we have services from the pharmacy. Patient bila tengok online, phone punya apa ni, consultation, how do you send medication? Inilah drive-through, some of them is through post laju, okay, some of them through pick-up, you know. These are some of the innovation they had. Some of this has stopped, you know, but I think we must think back whether we should continue these services. Then you have the, macam setakat tadi lah, new access to apa ni, promotional materials, okay. So a lot of you have done well in this, you know. You have made posters, you have made short apa ni, promotional material online for our patient. And we had also increased our phone line help mental support, okay. As I mentioned to you just now, dari awal lagi, we cannot do it alone. We cannot do it alone. We need a lot of people support. Okay, so when we did this, people from Mercy, people from Kementerian apa, Wanita, with their talian kasih, so a lot people came in. A lot of them work with us. Okay, remember, we cannot work alone. We need other people to work with us. Okay, to make this, to achieve this. Okay. Okay, I think I stop here. I've spoken quite a lot. I hope that you all have take in the message. I think the most important here, most important message here is that mental health problems, okay, can be due to in an unequal world, okay, but we have a lot of opportunities to improve this to ensure that the population gets a good mental health, and do not be afraid to change. Okay, thank you very much. Assalamualaikum.
Waalaikumsalam. Thank you, Dr. Hajah Salina, for an interesting keynote address in explaining what mental health in an